it is important that you don't be ashamed for your feelings
Mm.
or for yourself as well. There is help opportunities, but to make the step to get this help, it's up to you. So you have to do that step on your own. We love to support you, to help you to make this step.
Welcome to the Young Changemakers podcast season 4. In this episode, we will be talking to inspiring young people from all around the world to explore how they are making a positive change in their communities. This podcast is a global Changemakers production. To learn more about how you can also make a difference, visit our website global-changemakers.net. Enjoy the episode.
Hi, everyone. Welcome back to another episode with the Young Changemakers podcast. Today, we're really excited to have Damian join us, another GCM alum, talking about his organization, the Zeta Movement. Tell us a little bit about you and what led you to start the Zeta Movement.
Yeah, my name is Damian. I'm 26 years old at the moment. I'm studying and living in Bern, Switzerland. I was part of Global Changemakers in 2019, and I have to say it was like the best week of my life. We had so much fun. It was such an amazing time. I'm a mental health activist with several associations. Zeta Movement is the one we founded together. Global Changemakers helped us as well in the founding process. Then I'm part of the board of trustees of Promentesana, Switzerland's biggest mental health association.
That's really awesome. So kind of what led you to start the Zeta Movement? What was your inspiration?
Well, it has all started with the question, what would I have need in the age of 15, 16 years old when I was suffering from mental health problems and diseases? I asked myself, well, what will be great to have in this age? And then we realized that we talk about sexual health in Switzerland in school. We talk about, yes, prevention, about violence, drugs, but we have never talked about mental health and mental suffering. So it was really hard for me to talk about it, to look for help, and I saw that it is really difficult, or it was it was hard to accept that I need help, and this was the reason why it came to Zeta Movement. Yes.
That's definitely inspiring to kind of see a need that, you wish you had, and then creating a campaign around hopefully providing that for people like you now through your work. So give us a little bit more about what the Zeta Movement does. How can people get involved, or how can they find you guys and reach out?
Yeah, well, our main goal is to break the taboo of mental health or mental illnesses. Therefore, we have a program where we go to schools, to youth association with a peer approach, where people in a good status of recovery goes to those youth organizations and schools, talk about their own experience, what they have learned, what was difficult for them with their own story. So we can talk on a personal basis. We can answer to many questions. We can get into a dialogue with young people about mental health. We are building a community as well where everyone is welcome. Everyone can talk about his feelings, about his troubles, about his questions. Yeah, we don't want that the taboo of mental health is still so present. I mean, especially like the topic of suicide is still a big taboo in Switzerland.
Mm-hmm.
Well, the people are starting to talk about the topic, but unfortunately not deep enough. So yeah, we have this ambassador project, we call it. An ambassador is a person between like 18 and more or less 30 years old with an own diagnosis or own experience at least with mental health problems. And the important thing is that we are not experts, we are not psychologists, we are experts in experience. Therefore, we always say it is important that a psychologist or a social worker joins us to go to the schools. The best thing is if we're able that, like the school psychologist can come and we can say, hey, and if you have any problems, if you have any questions, look, the social worker, the psychologist is there for you. You can have an appointment with him. And if that's not possible, we have a pool of many, many experts, and we can ask them, hey, can you join us? Can you help us? So it is important to protect ourselves, and it's important as well that the people, the ambassadors, don't have to answer to every question. Like, we're free to say, okay, that's a topic I don't know, I don't want to talk about, but we try to create a safe space where we can talk about this topic.
I think that's really great, because the ambassador is almost like an advocate for students who are going through mental health issues. And then obviously you have the psychologist and social worker to provide support, but you also need to provide a level of comfort. And I feel like that's what the ambassadors are there for, to help build that community. So you know you're not alone, and like you have people to talk to who are your peers, who are your own age, who might be experiencing similar things.
Exactly. And as well, like the different help systems we have in Switzerland, we have phone numbers where they can call at any time without paying anything. But first of all, you have to talk about those possibilities, those opportunities.
Right. And even letting people know that these resources are available, because sometimes there are government resources, but they're not communicated well enough. Like, people don't know that they exist. So
exactly.
Yeah.
That's the one problem. But on the other hand, the other problem is that many students know, or many young people knows there is a hotline where they can call. But the problem is that many people make jokes about it. Or making fake calls, for example, because they think that's funny. But then with any fake call, you have it is possible that someone with suicide thoughts or with deep troubles don't have access to the hotline because they have to wait. So we need to raise the awareness that there are help opportunities and that it is important to take them. Especially when I first went to a psychiatrist, I was really afraid with 16. I was ashamed to go there. So I knew that there were doctors and psychologists, psychiatrists, but I was afraid of going there because I thought, well, now I am at the bottom. Like, now I have to go to psychiatrist now. That's the end.
Right. I think the social stigma around it is so bad that it prevents people from seeking help. Yeah.
Especially for young people.
Yeah. So walk us through, is there like a training to become an ambassador? Are there certain areas that you focus on? To you in your organization, what does it mean to be an ambassador of the Zeta Movement?
For being an ambassador, there's a registration process. First of all, you have to make a small application where you reflect about your own story and your own issues, because it's important, as I said before, that the ambassador are in an advanced recovery status. So you can't talk about mental health in front of a class if you're still suffering really deep from depression or whatever. So that's really important that we have a look at them. Okay, I don't like to talk about are you sick or not. It's like, are you on a way where you can talk about it with a
Are you like comfortable talking about
it? Exactly, yes. Then there is also a psychology professor who helps us. She's looking at the application, she's reading everything through, and after that we have an ambassador workshop. There we learn everything about Zeta for sure, about our values. The main thing is to learn, okay, how can I talk about mental health? Which topics are involved? And on the other hand, there are still topics we can't discuss with young people. For example, we talk about suicide thoughts, suicidality, but we do not talk about concrete atoms or self-harming behavior, what we have done, because you have this copycat, I think it's called in English. So it is dangerous That's what we learn there, and we have a safe space. It's like a training. The ambassador or the ambassador who has applied can try to talk about their story, and we can give them feedback. We learn about storytelling. Yeah, the whole course is about like 3 hours.
Okay.
It isn't that big, but it is important.
Mm-hmm.
And then if you go to a school class or whatever, the first time one of the board members join them, so that we don't let them. We give them many freedoms, so they are free how they want to talk about it. They are free to say, okay, I just want to talk about this topic or not. But yeah, especially for the part about Zeta Movement, and if there are any questions, we join them for the first time.
That's interesting that you talk about the copycat. I actually learned about it recently myself. So I'm kind of curious about, you work with schools to do these workshops. How did that partnership come into play? Do you and your campaign reach out to schools and form those partnerships? How has that conversation been with the schools? Have they been receptive to having you guys on board and doing that?
So the cool thing that the workshops are for free for the schools. So because Switzerland is like really diverse, we have a big countryside, schools on the countryside with less financial possibilities, so we don't want to exclude them.
Mm-hmm.
At the beginning of the project, it was the board members, especially me, who contacts the people, like the schools, can we come to you? And it was a lot about knowing someone who is maybe a teacher or a headmaster. But now the nice thing is that many schools have heard about us, so they are contacting us for a phone call and asking us, oh, I've heard about your project, like we'd like to have the topic of mental health in our school or association. Is it possible that you come? And then we have partner associations as well.
Mm-hmm.
For example, in the canton of Bern, there is like an association who does school visits as well on the topic of depression. So we're working together with them. They are part of the psychiatric clinic in Bern. So sometimes they are reaching out to us, hey, we need someone with peer experience, can you come? So it is changing, yes. At the beginning, it was really, really hard to find schools for a pilot project. And now I would say it's like more 50-50, and we have started the project 1 year ago. So some schools reached out to us and asked, hey, can you come again? And that's amazing. It's like the best feedback you can have if they say, hey, it was great last year, so please come again.
Back. Yeah, for sure.
And I was asked from a psychology professor to join the class. It's a master class about clinical psychology. And she asked me, hey, can you come talk about like Zeta Movement, about depression, about psychosis? So it's getting bigger and bigger, and the people who are asking us for an ambassador visit are so many. And from the different parts, sometimes we don't even thought about, well, maybe we can go there, but now the questions are coming.
It just shows that this is such an important topic and people need the community that you're building. So that's definitely really glad that the campaign's growing and people are reaching out for these workshops. I am also curious about, in terms of what the mental health conversation in the schools are like, have you ever had a conversation with a teacher or like a principal that kind of stood out to you when doing these workshops that you'd like to share?
Well, I really love the question of the young people. At the beginning, it is mostly the case that they are not asking questions. They are maybe a bit afraid, or first they have to learn, okay, this is a place where I can ask any question, everything I'm interested in. And then if the ice is broken, there are so many questions. I know a young girl asked me, have you ever been in a situation where you haven't seen any light? And then I asked her back, are you talking about suicide?
Mm-hmm.
And she was like, yes. And then, yeah, sure, we can talk about suicide.
Mm-hmm.
I do have experience with it. I know how it feels.
Mm-hmm.
But another thing is to explain them how you can find help in this difficult situation.
Mm-hmm.
Or one time I was really at the countryside, and it was quite hard during the ambassador visit because there weren't many questions and the young people didn't talk much. And I was like, okay, it wasn't successful.
Mm-hmm.
But the social worker contacted me after it and said, hey, it was amazing. 2 girls asked him for an appointment next week, and then another girl joined as well. So even if it's difficult during the ambassador visit, as long as people realize, okay, there are health opportunities and it is important to take them, and it's okay if you not feel okay at the moment, then we are successful.
Mm-hmm. That's really amazing. And I think it's also really brave to go and talk about your own experience, and connect with students that way, because it's not always an easy conversation, and it takes time to build that trust, and just being vulnerable in that way as well, I think can be difficult. So that's really great that they, reached out to the social worker, because that's the whole point of the movement and the workshop. So I'm sure it feels really good to see that students are like, once, your team goes in and talks to them, you've kind of created that trust and that comfort that they are ready to reach out for help. So that's really, really great.
Yeah, and Switzerland has many different languages.
Mm-hmm.
So for such a small country, it is quite difficult. With every language, you have other mentalities. Now we have many school visits in the German region and in the Italian-speaking region
Mm-hmm.
of Switzerland. Now we are focusing as well on the French part. So since at the beginning of Zeta Movement was more than one language, and we always said, hey, we tried to open it so if we have conversation, we are talking in English, Italian, German, and French,
Mm-hmm.
so that there are as many people as possible can have a look at our content on social media, on our project and everything.
That's really great. So switching from the Zeta Movement, I also wanted to talk a little bit about the current situation, COVID-19. How do you think the conversation around mental health has changed during the pandemic, either in Switzerland or globally? Kind of what has your observations been?
In Switzerland, I have realized that many people were confronted with loneliness, maybe depressions. So I heard many people who are suffering. And I know that the situation at the psychiatric clinics are worse. It is difficult. There are so many young people who need help. And I have a friend who is responsible for the psychiatric clinic in Bern, and he told me it's like really, really hard.
Mm-hmm.
On the one side, you have many young people who need help, and on the other side, you have many workers who has COVID, so they have to be at home.
Right.
So it's like on both sides, it's difficult.
Mm-hmm.
And I know that there are more young people with suicide thoughts at the moment. It showed many people, okay, that mental health is more important than we might thought like 3 years ago.
Mm-hmm.
So there is a changing. Even if you go to school, I realize there are more questions about loneliness, about sadness, with all, the whole isolation, and we couldn't see each other. I mean, even I was a student, I was like home the whole time. I couldn't see my friends. I don't know what were your experience, but I realized that it's difficult. I mean, I was 24, 25 years old.
Yeah.
For other people, it was like really, really difficult. Yes.
Yeah.
Hi there. We hope you're enjoying the episode so far. At Global Changemakers, we support youth to create a positive change towards more inclusive, fair, and sustainable communities. We do this by providing skills development, capacity building, mentoring, and grants. Head to our website, global-changemakers.net, to join our programs and use our resources. Now on with the rest of the episode.
No, it was definitely difficult. I was thankfully with family, so I still had people like that were around me, which was nice. But I know now, now I'm living alone. Like if I don't have anything for like a whole day, I always like try to make some type of plans with a friend just so I can go outside, see someone else. So not having that interaction would have definitely been difficult. So it seems like it's opened the conversation around mental health, like it's become more mainstream, which is definitely a good thing. How do you think the current, like the healthcare system in Switzerland has responded to the rise in the need for more support around mental health? Has it gotten better? Has it gotten worse?
Well,
Are there
Switzerland
conversations around it? What's your take?
Switzerland has like many opportunities for people who are suffering, if it's mentally or physically or financially. So our social work is amazing.
Mm.
I mean, compared with other countries, we are on a high level.
Yeah, doing really well.
So no one in Switzerland has to be afraid to be on the street and at the end. So even if you have financial problem, we have social services, we have clinics, we have good opportunities at school. Now, I would say every school has social workers or psychologists or both.
Mhm.
Mm, So yeah, Switzerland is a big privilege,
Mhm.
and even and as well with with the insurance,
Mhm.
every 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 person in Switzerland has to have a health insurance. So that helps a lot. And I know that the psychiatric clinic here in Bern um, has put more beds in it, and unfortunately was the case that they just can focus on really hard problems at the moment. So people who need a diagnosis, for example, they have to wait quite a long. I know the situation when I needed help, urgent help, and I got them. And if I imagine I couldn't have this help at that moment,
Right.
I don't know if I would still be alive if I hadn't. And then if I realized that so many people have to wait, they are already in a difficult situation and now they have to wait as well. That makes me feel quite sad and anxious as well.
You said at the age of 15 was kind of when you realized you needed help, and now you're 26?
26, yeah.
26. As someone who was 15 and needed help, and now doing what you do, kind of what has that journey been like for you?
It has changed a lot.
Mm-hmm.
I remember when I was 15, 16 years old, my biggest issue was to tell to someone else. I mean, even to my brother, who is probably the most important person in my life, and he will ever be. I couldn't talk about it. I was hiding it. If I were in school and I needed to go to my doctor, I wrote in our booklet where we have to write, why we're absent. I wrote, I need to go to see my, I don't know. I just said, I've had a headache, for example. And I remember when I called my doctor, well, just the first time to say, hey, I think I'm struggling about mental health. I was so afraid just to call the doctor.
Mm-hmm.
And then with 16, my psychiatrist decided to say that I have to go to the psychiatric clinic today.
Mm-hmm.
And I was like, no, I have to go to school because I thought school and job and everything is the most important. So no, I can't go there. I need to go need to go back to school.
Mm-hmm.
Then I would say it was hard at the beginning of being in a psychiatric clinic because I thought I am the only person who has ever had experience with psychosis.
Mm-hmm.
And then I got there and someone asked me, another patient asked me, hey, why are you here? And I said, yeah, like depression, psychosis. And he said, okay, so you can talk to him, to her, and then there's someone else as well who has the same. And I was like, okay, I'm not the only one.
Yeah.
And then I realized it's okay that you aren't feeling okay at the moment, but that I talk openly about the topic of mental health and mental illnesses. That was just maybe like 5 years ago. So it was a big step to talk in front of an audience or to get with newspapers about it. But I said to myself, I knew it was risky. I mean, the internet won't forget. But I said to myself, okay, now you're in a good stage of recovery, and you have to do that. I mean, every movement started with someone who said, okay, I'm part of it. Same as being gay or whatever. At the beginning, it is hard. But now the last years, maybe the last 2-3 years, there is coming up like a mental health, a community is growing up.
Right.
In Switzerland that, for example, famous musicians speaks about their problem, or sportsmen, sportwomen, even in my study environment or working environment.
Right.
There are people who come to me and say, hey, I heard what you said in the radio, and I just wanted to come to you and say, hey, I have to say, or I feel the same. So I don't think that you should be ashamed of it. But on the other hand, I don't say to everyone, hey, go coming out, go to public, scream it out.
Right.
It is something everyone needs to know for himself. And we are having a Mad Pride in Bern this summer. It's like the second time that the Mad Pride is in Switzerland.
Okay. Talk a little bit more about what that is.
I don't know much about it, but it has started in Canada. It came from the Gay Pride. So
okay, yeah, that's what I was thinking of. So I was wondering.
It has the same spirit, and
okay,
to come out to show, hey, it's okay if you are suffering.
So it's like a similar overall goal, but it's to kind of have people come and get rid of the taboo. Okay, that's why I was like, I heard Pride, and I was like, oh, is it similar to
It is. Exactly. It is similar to it.
Okay, that's really good that they are having that this summer.
I don't know how many people are coming. Unfortunately, there is a collision, and it's at the same time as such as the Gay Pride.
Okay.
And I know it was difficult for the organization committee because of COVID. They need to postpone it twice, and then it wasn't possible to make them on another date. So I'm a bit. It's sad because I wanted to join the Gay Pride and the Mad Pride.
And
now I have to make a decision.
Well, thank you for sharing a little bit about your journey. And also, like you said, I think everyone's journey is so different. So everyone should decide what they want to do based on their own pace, their own level of comfort. I think that's definitely important for people to know. Let's talk about what's next for the Zeta movement. Kind of, where do you see this going? What are you most excited about?
We're having a new generation of ambassadors coming next week. So the next ambassador project people are coming. We have the workshop next week. So then it's always a bit more work for us because we have to join them at the beginning. We want to mentor them. We want to help them. And it's quite normal that they call me like the evening before, Damian, I'm afraid, and I have some questions. And we say, yeah, we're there for you. It's not a problem. So I'm really looking forward to the new people that are coming. We're trying to connect with other associations. That was a goal of us since the beginning. And now we aren't big, we aren't important, but the other organizations are seeing us. So we try to work together with them. I mean, especially in a non-profit area or voluntary work, you
Right.
don't have to fight against each other.
Yeah. Mm-hmm.
So we're working on really cool corporations. Unfortunately, I can't tell more about, but there is like, it's called the How Are You campaign. It's
Okay.
a campaign in Switzerland which focus the topic about, how are you?
Mm-hmm.
And we're trying to work together with them. We are already but we try to maybe to be part of it, of the campaign.
So you're focusing on building partnerships with other campaigns, bringing
Yes, building the
back
partnership,
Mm-hmm.
especially in the French part of Switzerland, where we aren't that active at the moment. And then there's always looking for new schools or getting called. We were called from, not from a prison, but from, it is for women who are, or for young women with criminal records.
Okay.
And they asked us, and now we're looking if it's possible or not. But I would love to do that. I mean, like, if we're going to schools, to youth organizations,
Mm-hmm.
and we shouldn't forget those people, as we shouldn't forget them.
Mm-hmm.
So there's many upcoming work. We are all working as volunteers. So really looking forward to it. I'm really looking forward to it.
Yeah, that sounds really exciting. A lot of new and kind of different projects also coming up, which I'm sure will teach you and the campaign like more things that you can bring to your workshops and your advocacy movement as well. So congratulations on all of those. Those sound really interesting.
Thanks a lot. Yeah, it's opening the horizon.
Mm-hmm.
I mean, I've never thought about going to a prison or something similar to a prison.
Right.
And now I was like, yeah, sure.
Yeah. And it'll be definitely probably different from the conversations you have like at the school workshop. So like figuring out how to build that trust and build that community with those individuals who might not necessarily, they might have more of a distrust in establishments and people. And I'm sure it'll be a very interesting but also rewarding experience to be those people in that type of environment.
Yes, and I think it's not something for everyone. So
Mm-hmm.
it's not that the ambassador has to do it.
Mm-hmm.
They don't have to do it. It's not a problem at all. We asked them, hey, there is we were asked for an ambassador visit. It's about this and this topic in this environment. Are you interested in?
Mm-hmm.
And then they can say yes or no.
Mm-hmm. Yeah.
So that's quite important. And something we are working on it hard as well is together with the government. I mean, in the end, our wish is that mental health is a fixed part at the school program in Switzerland. Mm-hmm. So that's something we want to achieve, but it takes time.
Mm-hmm.
So we have a canton. It's like a region in Switzerland. It's a canton.
Okay.
And with one canton, we are working hard on a corporation. Mm-hmm. So it will be on a government level. They will pay us. They will make advertisements for us as well. Mm-hmm. So that's the goal in the far future.
Sure.
That it is fixed, established in the school program of any school.
Mm-hmm. I think that would really help a lot of people, and having that as a fixed thing that students have access to will also help, reduce the taboo around the conversation as well. So,
I mean, I remember the time when an ex-addict person came to our school and just talked about his life. He said, don't take drugs, but it wasn't like that a professor came to us and said why drugs are bad. It was like, he said, look at me, and then you see that drugs aren't good. And with him, we could talk openly about drugs. We could ask him about his life, about his experience. And then we talked openly in our class why we don't want to take drugs. And same with sex education. Well, now it's on Netflix, but this conversation opened the dialogue in the end. If you have program in Switzerland, you have program where gay people go to schools as well and talk about being queer and homophobia, sexism, all those topics. So I think it's something else if even affected a peer person come and talk on a friendly level with the young people. It's something else than if a doctor goes and talk why it's important to take care of your mental health, for example.
I agree. So I have some experience doing workshops around the issue of consent education. And it's really interesting because I feel like, at least when I was growing up, it was more like you were told, don't do this, don't do this. Like you were just like dictated things with no background on why, or like adding that human side into why you shouldn't do drugs or why you shouldn't engage in certain things. And I feel like as a young adult too, I feel like there's so much more power in bringing that personal side and using that to show young people, why this is okay, or why, like, it almost gives them the tools to think through their decisions. And I think that's the strongest way of getting any message across. So that's why I love anything around like peer-to-peer community building, because by sharing our experiences or what we've been through, you're almost giving students the power to decide what's best for them. And I think with any issue, I feel like that's the way to kind of go about it than just telling them. Yeah.
And an ambassador visit is about 1.5 hours, and then we are gone. So it's not that it is a big program for the school. It should be easy to implement. It should be they don't have to pay if they can't. But we are talking with the classes, with the teachers before. We explain them what we are doing exactly. Maybe that they can already talk to their student or to the people before, and then when we are gone, it's important that they talk about it 1 week later
to keep the conversation going.
Exactly.
But
sure. we don't want to help them through their crisis as a person, so we don't share personal contacts with them.
Right.
If they have any question, they can write an email on Zeta Movement or on Instagram or whatever.
Right.
But it shouldn't be like that they are coming to us for saying, hey, can you help me? Can we meet each other afterwards? And if we get an email where someone is reaching for help, for sure we're there. But we try to show them, look, for example, you have had the social worker during our presentation. So why do you don't contact him? Maybe we can. Well, here is the number of healthcare services, but
or like make an introduction to help.
Exactly.
Them. Yeah.
We are not psychologists, and we don't want to be psychologists.
Now that we're coming to kind of the end of our podcast, if someone is listening to this who might be going through some things, what would be like your advice to them? Something you would share in the workshops, or what would you kind of want to say to them, just on a very general level?
It is important that you don't be ashamed for your feelings or for your soul as well. There is help opportunities, but to make the step to get this help, it's up to you. So you have to do that step on your own. We love to support you, to help you to make this step. And that there are, as mentioned in Switzerland, are so many help systems, help services. So use them if you need them. And it's better to use them not too late. So it's better to look for help. If you're realizing you're suffering, then go for it. They are there for you.
Yeah, and also that, if anyone is feeling the taboo, the social stigma, knowing that not everyone, maybe the current people in your circle are like that, but not everyone is. Like, people are willing to listen and are open and understand that, everyone goes through things and are willing to listen and be available. And like you said, there's a lot of resources out there as well. So tell them how they can find information about your movement, how they can get involved.
Yeah, we are. Our website is zetamovement.com. You can follow us on Instagram, zeta.movement. We are also on Facebook, LinkedIn, and we're looking forward. If you have any question, write us on Instagram. And yes, and take care to yourself and to your friends.
Sounds good. And we will add all of the links at the end of the podcast as well. So if anyone wants to follow their movement, get involved, apply for the ambassadorship, it'll all be down in the comments below. Well, thank you so much, Damian, for your time, for being so open about your journey, for talking to our listeners, for being vulnerable, for being brave, and also for starting, such a great movement that so many young people need, and for building such an awesome community. I wish you all the success for the future of the Zeta movement, and for yourself as well with all of your studies and everything else that you hope to achieve. So thank you so much.
Thank you so much for listening to this episode. If you want to reach out, you can contact us via email at info@global-changemakers.net. Send us your comments, questions, or suggestions. Join our global community of young changemakers on Instagram @GlobalChangemakers, Twitter @WeAreGCM, and Facebook. Remember to rate, review, subscribe, and support. To help us continue to inspire more young people, share this podcast on your social media or contribute with your donations. Find all the info and links in the comments below, and see you in the next episode.